Hey folks, Dr. Hagmeyer here. Today I want to teach you about some of the most dangerous artificial sweeteners you might be consuming on a daily basis and why you want to avoid them. Now the information in today's video can really be a life changer, it can be a game changer with your health if you become more aware of these dangerous sweeteners, where you find them, and you begin to look at these food labels. Now if you've been a YouTube subscriber or if you visited my website, then you know that I specialize in working with people who have chronic health problems. And you know that I believe that no matter what your health problem is, this needs to start with dietary changes and lifestyle changes. 90% of my patients have gone from doctor to doctor to doctor trying to get healthy, and the only thing that they ever get is more medications on leaving that doctor's office or a bunch of supplements and no dietary changes, and this has got to stop. We need to start asking ourselves why we get sick in the first place and start putting our efforts on finding the root cause of really why we develop sickness and disease, and really learn what we need to do in order to rebuild our health. Now, if you don't ask this question, okay, you're never going to end up with an answer that brings you closer to optimal health. One of the things I would encourage you to do today, and this is something that I do with every single new patient that starts in our practice, is have them record a 7-day food diary. So that I would encourage you to do the exact same thing. Over the next 7 to 10 days, start writing down everything that you're eating, okay? The thing is here is you might be thinking that you're eating really clean, but after you write down every single thing that you've been eating for the next 7 to 10 days, and you review that and you start highlighting all these foods that you shouldn't be eating, you're going to see just how quickly many of these foods add up, okay? And you're going to start to see how many of the foods that you're eating are really robbing your health and robbing your body of the vitality that it deserves. So with that introduction, today what I want to share with you is some of the most common sweeteners that I see people using day in and day out that, again, are just robbing and stealing that vitality from your health, okay? Number one on my toxic and dangerous sweeteners that you want to avoid is aspartame. Okay, aspartame, you hear a lot about it, but yet people still, millions of people around the world are still using this dangerous sugar. It's a man-made sugar. It comes from phenylalanine, it comes from aspartic acid, it comes from methanol. And currently, aspartame is consumed by over 200 million people around the world, and it's found in more than 6,000 products. Okay, many people over the years have become more aware of the damaging effects of aspartame can be to their health, and so in an effort to not lose any further revenue, what these manufacturers are doing in order to attempt to remove themselves from this negative association of aspartame, and they've gotten really clever with this. Manufacturers have renamed aspartame to something called amino sweet. So you've got to be on the lookout for this, okay? It's a clever little renaming game. It happens every couple years with many different manufacturers, but it's something I want you to be aware of. Many people have nasty side effects like headaches and chronic pain and fibromyalgia and anxiety, memory problems, abdominal pain, nausea, depression, neurological disorders, heart palpitations, seizures, brain tumors. The list, folks, goes on and on. The main problem with these so-called sugars is that aspartic acid and phenylalanine in certain individuals can have a direct impact on the brain. It can have a direct impact on the central nervous system, okay? This is why the symptoms range from something as simple as a headache in one person to things like depression in another to a brain tumor in another individual, okay? Remember, aspartame not only phenylalanine and aspartic acid, but it also contains methanol. And the problem with methanol is that when it gets broken down into formaldehyde, okay? And that's a huge problem. Manufacturers of aspartame say that methanol and its byproducts are quickly excreted through the body, but research has found measurable amounts of formaldehyde in the livers, in the kidneys, and brains of people who ingest aspartame on a regular basis. Here's where you're going to find aspartame. Number one, you're going to find it in most carbonated soft drinks. You're going to find it in a lot of powdered soft drinks, chewing gum, confection powder, gelatins, dessert mixes, puddings and filling mixers, frozen desserts, yogurt, tabletop sweeteners, and of course even some pharmaceuticals. Now this is just a small sample of where you can find it, so I really want you just to start becoming a food label reader, okay? Number two on my hit list of sugars to avoid is sucralose. Sometimes you're going to see this is also known as Splenda, but it's important that when you start reading labels that you just don't get hung up on aspartame or getting hung up on Splenda, because again, you want to start looking for the other names like sucralose. Okay, not all companies are going to list in their ingredients Splenda. So this is again another laboratory concoction whereby labs start out with table sugar, which is sucrose, and then they turn it into something that's very, very different, very, very different in your body. Now, sucralose is made by replacing 3 hydrogen-oxygen groups on the sugar molecule with 3 chlorine atoms. Now, when chemists do this, the end result is an intensely sweet, no-calorie sweetener. And so that might sound great, right? For a lot of diabetics out there that are looking for sugar alternatives, it has 0 calories. You know, it doesn't necessarily, these sugars don't necessarily affect your blood sugar levels, and that might sound great, but there's huge problems that are inherent to that, okay? So the other thing is that many food companies that use sucralose also add maltodextrin. Now, this can be a double whammy if you have either celiac disease or you have any kind of gluten sensitivity or an autoimmune disorder or even an inflammatory bowel disease, okay, like ulcerative colitis or Crohn's. Neurological studies, as well as many people who have once upon a time used this sweetener, can tell you that it causes fatigue, it causes brain fog, it causes headaches, it causes thyroid problems, again, anxiety, depression, dizziness, hypoglycemia. This is a big thing. It can cause low blood sugar, some of these sugars, and this can all be exacerbated by the use of sucralose. The manufacturers of sucralose are pretty savvy, okay? They'll tell you that the chlorine in sucralose is really no different than the kind of chlorine that is, you know, with your table salt on your salt shaker. But the fact here is that the chlorine in sucralose is now a chlorocarbon, and this is in no way like the table salt that's on your table, okay? Chlorocarbons, such as sucralose, deliver chlorine directly into your cells through normal metabolism, and these chlorocarbons damage the hepatocytes. These are cells that really make up your liver. Many other studies show that sucralose can produce swollen livers. It can cause calcifications within your kidneys. This has been shown in test animals and in toxicity studies. Research has also shown that sucralose can cause shrinking of the thymus gland, which is just a very important part of your immune system. It regulates your immune system. It can affect pancreatic function, which of course regulates your blood sugar. And these sugars have also been shown to affect kidney as well as brain function. Now, a recent study that I came across not that long ago was done by Duke University, and what they found was that sucralose caused or reduced the healthy intestinal microflora that is supposed to be in your gut. Now, you know that sickness and disease starts in the colon, and if you've watched any of my other videos related to thyroid disease or autoimmune disorders, the last thing you want to start doing is altering that microflora any further. That gut microbiome is a huge part of your immune system, okay? Studies show that 70% of your immune system lines your gut, and if you alter that microflora in any way, either with medications like antibiotics and antacids and steroids, or you affect that immune system and alter that microflora by the exposure of these synthetic sugars, you are just a bomb waiting to go off, okay? You're putting yourself at greater risk for these autoimmune disorders, diabetes, metabolic problems, and so much more. Don't do that, okay? This is why it's so important in your quest for health to realize that it's not enough to think that medications is really going to make you better, okay? If you don't change your diet, if you don't start fixing your gut, if you don't start paying attention to what you're putting into your body, and you don't start addressing the root cause, you're never going to get better, okay? Now, here's another study, okay? This study showed that sucralose alters glucose levels, and it affects insulin levels when used in cooking and at high temperatures. It can also cause or create something called chloropropanols, okay? As you can see, this 0-calorie sugar is not all that great for you. Splenda, Trident gum, okay? Many times your next door neighbor who might be selling certain supplements, Herbalife for example, unknowingly in those, you know, shake for breakfast, shake for lunch, and a sensible meal, those shakes often contain these toxic sugars. And so my question is, how can a company that touts to be a company based on nutrition or weight loss, how can they still be peddling toxic sugars like this that studies show they cause problems? Now, third on my toxic list and on my chopping block is saccharin. Okay, saccharin, this is an artificial sweetener again. Studies show that it's 300 to 400 times as sweet as sucrose, which is again table sugar. And if you use this, then you're probably aware of the very metallic-y kind of taste, or the bitter taste that it provides. Okay, here you can see on this warning just on a Coke can. Okay. Like other sugars, it's used to sweeten products such as drinks and soda, candies, cookies, medicines, and again, toothpaste and mouthwash that you use in the hopes of keeping good oral health and hygiene. Saccharin is often added in with aspartame. So if aspartame wasn't toxic enough, saccharin's added to it. Interestingly enough, when people try and go on a diet, they often find themselves resorting to many foods that either through means of cooking or drinking contain saccharin. Here's a recent study showing just how saccharin and aspartame actually cause greater weight gain than actual table sugar, even when subjects were kept on the same caloric regiment, okay, between the test subjects. Okay, you can actually see this study here. So what can you take away from today's short video on these common everyday laboratory sugars? Well, number one is start out with a 7 to 10 day food journal. This can be a real wake-up call for many of us. Takeaway number two, make sure that you read your labels. Okay, these sugars are found tucked away in so many different innocuous spots. Things again like chewing gum and snack bars and supplements, hard candies. Again, take a look at those food labels. Number three, move away from foods that come in packages. This is an obvious one, but you know, in the essence of trying to be quick and expedient and we're always on the run, we tend to eat most of our food that comes from packages. Let's face it, while it's convenient to buy these foods, people only get sicker and sicker when they depend on laboratories for nourishment. The makers of your food, if you decide to eat packaged foods, believe it or not, these are the same companies that are making your medications. And to me, this is a part of what's wrong with our so-called healthcare system, okay? I'm not sure about you. You can call me old school, but I'm not really into eating foods that have been made by companies like pharmaceutical companies, or foods that have been genetically modified, or foods that have been sprayed with Roundup and pesticides, or even eating meat that comes from factory farmed animals. Now, if you're struggling with any health challenge, and I know if you're watching this video, you probably are struggling with some health challenges, start your journey to better health by becoming your own health advocate. Start looking at the foods you eat. Start looking at or start realizing you know, where these foods are coming from. Okay, that's going to be the most important thing you can do. You'll never ever get better by taking a handful of medications and ignoring the real reason for sickness and disease. I'm Dr. Hagmeyer. I hope you enjoyed today's short video. Until next time, take care of your body because it's the only one you have and it's got to last your lifetime. Take care.